Did you know that 99% of Americans aren't aware of the early warning signs? It's true. This lack of awareness can lead to late diagnoses, which are harder to treat. We need to change that. Prostate cancer is one of the most common cancers in men, but the good news is that when detected early, it's highly treatable. Early detection can lead to a nearly 100% survival rate, which is why it's so important to know what to look for. The problem is, the symptoms are often subtle and easy to dismiss. Many men might not even realize that what they're experiencing could be a sign of something more serious. We're talking about changes you might not even think twice about. Things like frequent urination, especially at night, or difficulty starting and stopping urination. These can be easy to overlook, but are important to pay attention to. But trust me, recognizing these 8 key signs could make all the difference. Other symptoms include weak or interrupted urine flow, blood in urine or semen, and discomfort in the pelvic area. If you notice any of these, it's crucial to see a doctor. Don't ignore what your body is trying to tell you. Your health is too important to take chances with. Stay informed, stay vigilant, and take action if you notice anything unusual. Early detection can save your life. Let's talk about the first sign: frequent urination, especially at night. This is something that many people experience as they get older, but it's important to understand that it can be more than just a sign of aging. Guys, if you're waking up multiple times to use the bathroom, it's not just getting older. This could be a sign that something more serious is going on with your health. Frequent urination at night, also known as nocturia, can disrupt your sleep and leave you feeling exhausted during the day. It could be a sign of prostate issues, including cancer. The prostate gland is a small gland located just below the bladder in men, and it plays a crucial role in the male reproductive system. However, as men age, the prostate can become enlarged, leading to a condition known as benign prostatic hyperplasia, or BPH. Now I know what you're thinking. Dr. Mike, I drink a lot of water, it's normal. While staying hydrated is important, excessive urination at night is not something to ignore. It's essential to differentiate between normal hydration and a potential health issue. But here's the thing. The prostate gland actually surrounds your urethra, which is the tube that carries urine from your bladder. When the prostate enlarges, it can squeeze the urethra, making it difficult for urine to pass through. This can cause a frequent urge to urinate, especially during the night. When the prostate is enlarged, it can press on the urethra, making you feel like you need to pee all the time, especially at night. This constant pressure can lead to incomplete emptying of the bladder, which means you'll need to go more often. This is often one of the earliest signs of a problem, so don't just brush it off. If you're experiencing frequent urination at night, it's important to talk to your doctor. Early detection and treatment of prostate issues can make a significant difference in your health and quality of life. So, pay attention to your body and don't hesitate to seek medical advice if you notice any changes. Next up, we're talking about weak or interrupted urine flow. Guys, have you ever noticed that your urine stream isn't as strong as it used to be? Maybe it's slow, weak, or it starts and stops? This is another sign that something could be up with your prostate. Think of it like this. Your urethra is like a garden hose, and an enlarged prostate, or God forbid cancer, can be like a kink in that hose. It's going to restrict the flow of urine, making it difficult to empty your bladder completely. If you're experiencing this, don't just try to power through it. Get it checked out. Okay, this next sign goes hand in hand with the last one. We're talking about difficulty starting or stopping urination. Ever feel like you have to strain to get your urine flowing? Or maybe you feel like you can't fully empty your bladder. This can be super frustrating, and it's another red flag that something's off with your prostate. Remember how we talked about the prostate potentially blocking the urethra? Well, that blockage can make it tough to start and stop your stream. It's like trying to turn a faucet on and off with a pair of pliers. It's just not going to work smoothly. Chapter 4. Blood in urine or semen. Alright guys, this next sign is a big one, and it's something you should never ignore. Blood in your urine or semen. This can be alarming, and understandably so, but it's important to stay calm and take immediate action. I know it can be scary to see, but it's crucial to get it checked out immediately. Ignoring it or hoping it will go away on its own can lead to more serious health issues down the line. The sooner you address it, the better your chances of identifying the cause and getting the appropriate treatment. Blood in your urine, also known as hematuria, can appear pink, red, or even dark brown. This discoloration is due to the presence of red blood cells in your urine, which can be caused by a variety of factors. While it can be caused by other things like urinary tract infections or kidney stones, it can also be a sign of advanced prostate issues, including cancer. Urinary tract infections are common and can cause discomfort, but they are usually treatable with antibiotics. Kidney stones, on the other hand, can be extremely painful and may require medical intervention to remove. Now, blood in your semen might be less obvious, but it's just as important to address. This condition, known as hematospermia, can be a sign of various underlying issues, ranging from infections to more serious conditions like prostate cancer. It can look like streaks of blood or give your semen a brownish tinge. If you notice any changes in the color or consistency of your semen, it's important to consult a healthcare professional. They can perform tests to determine the cause and recommend the best course of action. Remember, early detection and treatment are key to maintaining your health. Chapter 5. Erectile dysfunction, or ED. Let's talk about a sensitive subject, erectile dysfunction, or ED. Guys, if you're having trouble getting or maintaining an erection, it's not always just in your head. It can be a physical issue, and sometimes it can be linked to changes in the prostate. The prostate gland is located right next to nerves and blood vessels that are crucial for healthy sexual function. When the prostate is enlarged or cancerous, it can press on these nerves and vessels, interfering with blood flow and causing ED. Now let's talk about pain. Specifically, persistent pain or discomfort in the pelvic area. This can include your lower back, hips, thighs, or even your rectum. While pain can be caused by a variety of factors, it's important to pay attention to any persistent discomfort in these areas, especially if it's accompanied by other symptoms we've discussed. Prostate cancer can cause pain as it grows or spreads to nearby tissues and bones. So if you're experiencing any unexplained pain in your pelvic region, don't just try to tough it out. Get it checked out by a doctor. This next sign might seem like a good thing at first, but trust me, it's not. We're talking about unexplained weight loss. If you're suddenly shedding pounds without making any changes to your diet or exercise routine, it's crucial to see your doctor. While some weight loss can be normal, rapid and unexplained weight loss can be a sign of several health issues, including advanced prostate cancer. Last but not least, let's talk about fatigue and weakness. We all feel tired sometimes, but if you're experiencing persistent fatigue that doesn't go away with rest, it could be a sign of something more serious. Prostate cancer can cause fatigue in a couple of ways. First, it can lead to anemia, which is a condition where your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. Second, the cancer itself can release substances that make you feel tired and weak. Guys, I can't stress this enough. Don't ignore these signs. Early detection is key when it comes to prostate cancer. If you're experiencing any of the symptoms we talked about, please see your doctor. Men over 50 should talk to their doctors about getting regular prostate cancer screenings, including PSA, prostate-specific antigen tests, and digital rectal exams. If you have a family history of prostate cancer, you might need to start screenings even earlier. Remember, knowledge is power. The more you know about your body and the warning signs of prostate cancer, the better equipped you'll be to